Welcome to day one of the Division of Workers' Compensation Healthcare Provider Outreach Boot Camp, day one. We are glad you joined us for this workout series. Again, this is an 8-part high-intensity training series, and it's designed to give a healthcare provider and the staff, sometimes insurance carriers and adjusters, information and confidence to navigate the world of Texas workers' compensation. We're going to show you around the DWC campsite, also known as our website, and help you get stronger in your skills as a workers' compensation professional and be able to represent your clinic, your company in all aspects of providing treatment to injured employees of Texas. This webinar's topic is Introduction to Workers' Compensation, and let's start warming up. Line up your troops because we will not keep you guessing much longer. We're going to take you over this suspension bridge into workers' compensation land. Going into the workers' compensation land, you will need to know your way around the campsite of workers' compensation. This presentation is going to give you the knowledge of the DWC website using the handy workout tool, our famous A through Z tool, which is very intuitive for use of our website. You will gain an understanding of how Texas employers obtain coverage for their employees if they get injured on the job, and learn some basic training on Texas workers' compensation healthcare provider forms and some notices. So get out your workout supplies. Get ready to learn this introduction to Texas workers' compensation. Today's content is an overview of the workers' compensation system in Texas. And for some, this may be somewhat basic. However, the rest of the bootcamp series goes into much more depth. Stay tuned, attend our live webinars, or watch the bootcamp videos for more detailed information. Now, while you're warming up and stretching out, a reminder that this presentation is for your education. So, however, system participants are responsible for knowing and complying with the laws. That's the Texas Insurance Code, the Texas Labor Code. Those are the two sets of laws, and the Texas Administrative Code, also known as the rules. An overview of the topics for today's presentation. One is that we're going to review the Texas Workers' Compensation Regulation. That's the laws and the rules that pertain to our program. The legislature sets forth goals and legislative intent and the mission for the workers' compensation system of Texas, and we'll go over that briefly. Also, employers' Texas workers' compensation coverage. We'll talk about that. The required forms, providing health care to injured employees, and official notices. Let's get started with the regulation. You may be wondering, what is this thing, Texas workers' compensation, and how does it work? First, workers' compensation insurance that we're talking about today is a state-regulated insurance program. It does not involve federal employers, only employers, both private and governmental, in the state of Texas. And that basically this insurance program has two benefits. If someone's injured on the job, it pays for the medical bills for that injury. With very few exceptions, injured employees are not responsible for paying medical bills related to their injury or illness. And the second benefit it provides is it replaces some lost wages when that injured employee has lost time from their injury or illness. And that means they have a compensable injury or illness. That means covered. Every state in the United States has a different set of state laws and rules surrounding how their workers' compensation insurance program works. And Texas is unique from all the other states and is regarded as a leader in workers' compensation for several reasons. Now let's do a little bit of higher intensity workout looking into what makes an injury compensable, meaning it's covered. That makes the insurance company liable for payment for the two benefits we talked about. So when we say compensable, we mean an injury or illness that arises out of and in the course and scope of employment. This is defined in the general definitions part of the labor code, which is the the laws for workers' compensation in Texas. So 401.011 provides a lot of definition, including what is a compensable injury. Now, course and scope. Course and scope means that an employee was performing an activity that was required for their job, engaging in or about the furtherance of affairs of that business. So they're doing something that you've asked them to do as part of their job, and it furthers the affairs of your business. It can be on the premises of the employer and it can be off premises too. Also, it is regardless of fault. So if an employee is in the course and scope of their job and they're injured, they can have a covered or compensable injury, regardless of whose fault it is. See this guy here in the picture? He's placing a poster on the safety standards for all employees to see, and he may not be exactly following those very standards by stacking up those chairs in that way. Now, if he fell and was injured, he could have a compensable injury, even though it looks like it may have been somewhat his fault. So it's regardless of fault. So, from a historical perspective, this give and take between the employee and the employer was referred to as the grand bargain, whereby if an employee is hurt on the job, the process is streamlined to provide that employee with care and wage replacement in exchange for giving up their common law rights, thus protecting the employer from potentially crippling lawsuits from the injured employee. Now, in our system, there are some exceptions, even if they are injured in the course and scope of their job. The Texas Labor Code has 6 exceptions to the carrier's liability. And that means if even they got injured on the job, if it meets the criteria of one of these 6 scenarios, the carrier may not be liable. The first one is intoxication. Second one is if the injured employee willfully attempted to injure themselves or another person. Maybe there was a third person for a personal reason, unless the reason was related to employment. So if someone else came in the job site and hurt them for a personal reason, that may be carved out of workers' compensation, unless it had something to do with the job. The last 3 are participation in an off-duty activity not related to the job, unless they were absolutely required by the employer to do that off-duty activity. An act of God, unless the job exposed the employee to a greater risk of injury, or engaging in horseplay. So you see the exceptions to liability are all there and in the Texas statute. Speaking of Texas statute, let me give you a picture. Now that you kind of know what workers' compensation is in the state of Texas, this is a picture of the regulation for Texas. Again, this is not federal employers, those with the Border Patrol, IRS, Post Office. These do not apply to those scenarios. So if you look at the insurance statutes that apply to workers' comp, the Texas Insurance Code on the left there's certain sections of the Texas Insurance Code that covers like property and casualty, auto, home, wind insurance. There are certain sections, Title 2, 8, and 14, that apply and cross over to workers' compensation. 2 is about the administration. We are kind of combined with TDI. 8 and 14 cover the insurance workers' compensation certified healthcare networks that operate in Texas, and utilization review agent certification and monitoring. So those come from the insurance code. And in the labor code, that's all workers' compensation. So those are the laws. You may hear it referred to as the act or statute. So it has like 3 names, but it's all the law in Texas. Now, once the law is passed by the legislature, then the agencies write rules to further explain the implementation of the laws. So Part 1 of Texas Insurance Code, there are some rules in the insurance code side that apply to workers' compensation. And that's Part 1 of the Texas Administrative Code Title 28. Part 2 is all about workers' compensation. So some of the insurance side applies to workers' comp, and then on the right side, all workers' comp. Now, if you're confused there, I'm going to show you from our website what it looks like. You should be seeing the internet now. This is our website. It is a very large and robust website. You'll see that there's 3 tabs across the top, the insurance side, the state fire marshal, and the workers' compensation tab. When you're on this screen, this is for the entire site. This A through Z right up here is for the entire website. That includes insurance, state fire marshal, and workers' compensation. This A through Z, when you click on workers' compensation, this is the A through Z that is specifically about workers' compensation. I want you to understand that if you use this A through Z, you're going to get the entire website's search function. If you use this A through Z, this is the workers' comp A through Z, and that is the one that I primarily want you to use. Now, if you're looking for the insurance code, you'll click on that insurance tab there. Remember, some parts of the insurance code apply to workers' comp. I just go to the very bottom of the screen. Insurance laws are here. This is the insurance code and their rules. So again, not all of the insurance code applies to workers' comp, but those sections that I talked about. Now back to workers' compensation. If you were to go to our A through Z, right here, the Act will take you to the laws, and the R will take you to the rules. This A through Z is very intuitive. If you're looking for forms, you can go to F for forms, R for rules, A for Act, that sort of thing. So I wanted to show you that. Now, I'm going to show you the map that we gave you in your handouts. This may be helpful to you. I hope so. So everything on here is clickable. It's very interactive. And we have designed this map to be healthcare provider centric or medical benefits centric, I guess, if you will. It'll take you to every part of our website. So if you're looking for important chapters of the Texas Labor Code, it's not all chapters, but we have important chapters that are related to workers' compensation, healthcare provider operations, the administrative code, which are the rules, our webpage. That is where, if you go to our webpage, you can get our live and on-demand videos there that I talked about earlier. Your profiles, if you're a doctor, signing up and creating a profile, our treatment guidelines, return to work guidelines, pharmacy formulary, the forms we're going to talk about today. And then I go into the Texas Department of Insurance and those locations. So, you can save this to your desktop and use that, or you can just use our A through Z. Like I said, it's pretty intuitive. And while I'm at it, just a little commercial for us. If you have questions ever, you can always call us at Comp Connection or email us. And remember, we do not pay your medical bills. So if you're a hospital or ancillary provider or healthcare provider, don't send us your medical bills. It's just delaying your medical bill from being processed. So a lot of times we get medical bills sent in error to us, and then we have companies call us for medical bill status. We are not the insurance company. We are the regulators. So let me just move this map back over here and continue on with the presentation. So these are your regulations. If you are operating in workers' comp, it is best that your staff know where to find rules and laws, because if you're talking to an insurance carrier, you're going to need to know your laws and rules and your citations. This will benefit you and help you navigate the world of workers' comp better. The goals, the legislative intent that is written into our act and our law and our mission will be gone over next, and that you can find that in 402.021. The mission of the workers' compensation system. Of course, we want employees to stay safe, first of all. But if they get injured, we would like the mission to be timely return of those injured employees to productive roles in the Texas workforce. That's one of the key components of our mission. So if you're an employer out there, we have lots of training on return to work, or talk to your insurance carrier about return to work services. The longer someone stays off of work due to an injury, the less likely they will ever come back to the workforce. So paying attention to that at the very beginning is important, whether you're a healthcare provider or the employer. And that is one of our missions. Some of our goals is that while we're trying to get someone back to work safely and appropriately, they should have access to prompt, high quality medical care from our system of doctors and healthcare providers, restoring their physical condition and get back to their earning capacity, hopefully their pre-injury status, or maybe even better. Of course, I talked about it earlier, but we do provide lots of training and information about return to work as soon as it's safe and appropriate. There is under R in our A through Z, a return to work page. There's information for the employer, the injured employee, the insurance carrier, and it also explains what the division does to help someone return to work as soon as it's safe and medically appropriate. We also have some structure around providing that care and getting someone back to work. The structure is we have evidence-based treatment guidelines for the workers' compensation system. So scientifically backed recommendations for treatments for certain conditions. So conditions are listed in this treatment guideline and then recommended services and the scientific studies that back that up. And so that is our treatment guidelines. We also have a return to work guideline. This is where you can look in and see the type of job somebody had, the type of injury they had, and look at the average number of days that someone's off for that compared to a lot of other claim data. These two products are commercially available products. ODG, Official Disability Guidelines, is our treatment guidelines for non-network. Return to work guidelines is the MD guidelines. Again, it requires a subscription and it is commercially available to anybody that wants to purchase it. We also have employer return to work programs. We teach employers all across the state of Texas about how they can create a return to work program. And we have a guidebook for the employer on our return to work page about creating that return to work program. And it talks a lot about having communication with your employees before, during, and after an injury. Hopefully, no injury occurs, but if it does, a clear, concise communication about how return to work is good for everybody, including the injured employee. And then also, if the laws and the rules talk about case management, and insurance carriers can assign a medical case manager to one of these injuries if it gets complicated or extends beyond what the return to work guidelines say. So that is built into the structure of helping someone return to the workforce. Let's talk about Texas workers' compensation coverage. This is where Texas is unique. In Labor Code 406.002, it's titled Coverage is Generally Elective. And here is the chart. We're going to start with all Texas employers. Remember, this does not include federal employers. That is Department of Labor. We don't have the rules or the laws that apply to someone that works for a federal employer. So let's start with all Texas employers. On the left-hand side, we're going to divide up all Texas employers by two buckets, basically. On the left-hand side are those employers that have chosen to have or required by the law to have workers' compensation coverage. And on the right are the employers that do not have coverage. So it's a chart that shows that Texas is unique. That means that private employers can choose to have workers' compensation coverage or not in our state. So if you're a healthcare provider, one of the first questions you're going to ask is who were you employed by when you got hurt and did they have coverage? Because in other states, it is required and mandatory, not in Texas. So you're going to have to figure that out. The split between the two types, subscribers, those that have coverage, and non-subscribers, is about a 76-24 split. So 76% of our employers do have coverage in the state of Texas and 24 do not. So on the subscriber side, they can buy a commercial policy with one of the many, many workers' comp carriers in the state of Texas. They can be a large employer that has a certificate of authority from us to be a certified self-insured. Or they're a government employer that's required to have workers' comp coverage. So those are the subscribers. On the right-hand side, if you're a non-subscriber, there's some large employers out there that have chosen not to have traditional workers' comp coverage. Sometimes they have little accident policies or similar type policies, or they've gone without coverage and they handle it themselves. Um, so that's how it's split up in Texas. Again, 76-24%. Let's go over some of the required forms. These are not all the forms. If you want to see all the forms, you go to F on our A through Z, and you can see all the forms. We pulled the most prominent healthcare provider forms. The first one is, again, all relating back to that mission of trying to get someone back to the workplace as soon as it's medically safe and appropriate. And this is the work status report. Most injured employees will have a work status report at least once. Now, if they go to the ER and they're out, the ER is not required to fill out a work status report, but the first visit with a doctor will require one. So that's the Form 73, and this is what it looks like. Patricia is going to post in the chat the rule that regulates the use of this form. So this is what it looks like. You can find it under F for forms. The rule number is 129.5. Now, this form is not required on every single office visit. Just know that. And I'll explain when it is necessary. But the purpose of the form is the doctor is communicating with the insurance carrier, the employer, and to the injured employee about what they can and can't do back at the workplace or with or without restrictions. So that is their main communication. This is what keeps workers' compensation going. It helps the doctor sit down with the patient and talk about what they can do and what restrictions they may apply, or if they may be off work completely. That should be rare, but it does happen. So this is the primary communication. Nothing stops you as a healthcare provider from talking to the employer about work status. You may not talk about medical records and all of the test results, but you can talk about work status. That is important. But the main communication form is the work status report, the DWC 73. And it is submitted by the injured employee's treating doctor, or in this case, the mid-level or the properly delegated physician assistant or associate, if you want to call it, or APRN, advanced practice registered nurse. Those provider types can fill out the work status report and communicate it back to the injured employee, the carrier, and to the employer. So it's treating doctor or their delegated mid-level. Also, if you are the treating doctor's office and you're referred to an orthopedist, the referral doctor is going to submit it on the first visit. Or if they see a designated doctor, those are our specially trained doctors that are assigned by the Division of Workers' Compensation to resolve disputes. They can be filling out the work status report, or possibly a required medical exam doctor. This is an insurance carrier doctor. All of those can submit a work status report. And here are the times that a work status report is required. Again, it's not on every visit. It is after the initial exam, regardless of their work status. So say you can send them back to work that day, then write that on the form. So first visit always. Next time you're going to fill it out, coinciding with an office visit, if the employee experiences a change in their work status. Maybe you had them off work, now they can go back to work. Or maybe there's a substantial change in their activity. They couldn't lift anything, now they can start lifting. So that's a substantial change in their activity restrictions. That creates a need to have another work status report. But all those visits in between where nothing changes, you don't need one. There's one last time that it could be required, and that is a request by the insurance carrier. And it can't exceed one report every 2 weeks, or it has to be based on the scheduled appointments that you have with that injured employee. So those are the times that you can bill and be reimbursed for a work status report. There is billing allowed for the work status report. It's a CPT code 99080, modifier 73, and it's $15. If you're trying to bill for this report on every single office visit, the carriers will be looking at whether or not it met one of those criteria. Is it the first visit? Did something change, or did they request it? So those are the times that a work status report is required. The next report that's really important to our system is the report of medical evaluation. That is the DWC form 069. And Patricia's going to put in the chat a rule that applies to the report of medical evaluation. This is the report that is used by the treating doctor to indicate whether the injured employee has reached maximum medical improvement. That's a date. And it's used to also indicate whether the injured employee has permanent impairment as a result of a compensable injury. Now, on the first bullet, you don't have to have special training. The treating doctor does not have to have special training to assign an MMI date. They do if it's an impairment assessment. But that's what this form is for, is the MMI date, and if they happen to have impairment, you can jot it down there. So to further define maximum medical improvement is a date, and it's either based on a clinical status of your injured employee, or after an expiration of some amount of time, it's a statutory designation of MMI. So starting with clinical, if the doctor is assigning an MMI date, it means that they believe that their patient, their injured employee, has no further reasonable medical probability of further recovery or material recovery or lasting improvement to an injury can no longer be anticipated. So that's a clinical status on a date. If the patient hasn't reached that clinical status, then 104 weeks has passed since the date the income benefits began to accrue. The statutory MMI date is assigned to that claim or that injured employee. Now, there are some exceptions always in our rules and laws. There are some exceptions. The commissioner may extend that MMI date that's statutory if the employee has had spinal surgery or has been approved for spinal surgery within 12 weeks before the expiration of the 104-week period. Now, the impairment rating, let's talk about that. So there's two things on this form. One's the MMI date, and the other is if they have some anatomical or functional abnormality because of that injury. That's a permanent function, a loss of function. That could be impairment. It is a percentage of permanent impairment for the whole body. Now, in Texas, we are still using the AMA, American Medical Association Guides, the 4th edition. So all of the impairment ratings assessed in the current workers' compensation system is based on the AMA guides of evaluation of permanent impairment, 4th edition. And only a doctor that's specially trained may calculate that percentage. Those are usually designated doctors, RME doctors, Some treating doctors, like I said at the beginning, we would love for treating doctors to become certified to conduct the impairment rating assessment if their patient has some loss of function. And sometimes referral doctors, if the treating doctors does not have that certification and their patient may have a loss of function, they're going to refer it out to a doctor that is certified to conduct an impairment rating. Again, treating doctor that's not certified can do MMI only, but if there's a permanent impairment, they need to refer them to somebody that can conduct it, unless they're certified. Now, providing healthcare to injured employees, let's go over that a little bit. There are 3 systems in our workers' compensation program in Texas. Let me show you all 3 in this illustration. On the right, let's start on the right. About 50% of new injuries fall in this category, and that is those injuries walking in the door may be non-network healthcare. Those injured employees can choose any doctor that's willing to see them for their treating doctor. So those are called non-network claims. Claims in our system is an injury or illness. Now, the other half can fall in one of these 2 categories. The majority fall in the Certified Workers' Compensation Healthcare Network contracts. This is where the insurance code comes into play with the Certified Workers' Compensation Networks. This happened years ago that the market is allowed to create certified workers' compensation networks. So if your doctor is seeing a claim, an injury that is a network claim, that doctor, unless it's an emergency or unless he or she got special permission, they need to be contracted with that network. So it's about a 50-50 split. You need to screen those patients to find out if they're network or not, and if your doctor is part of that network. The other last category are the public employers, the intergovernmental risk pools. This is Texas Labor Code 504, as we call them, or political subdivisions, if you will. They can operate, these are like sheriffs, first responders, school districts. They can operate in one of 3 ways. They can operate like a certified workers' compensation network, which again, you're going to need to have a contract. They can operate like non-network, which means their employees can go to any willing doctor, or they can say it's a small town, they directly contract with the healthcare providers in that town. So those are the public employers like school districts, sheriffs, first responders. But basically, walking in the door, it should be about a 50-50 split where those 50% are contract and the other are non-network. So providing healthcare to those that are subject, those claims that are subject to a network. And just heads up, someone could work at 2 different employers and have 2 different injuries. One injury or one claim could be network, and the other claim, because that employer chose not to go with a network, could be a non-network. So you have to ask who they were employed with to figure out if it was network or not. Now, if you're a doctor, you must apply and be contracted with the network to be an approved network provider. So unless it was an emergency or you got special network approval, you have to be contracted with that network to treat and be paid for it. Medical reimbursement is determined in your contract negotiations. And you also have the requirement to make referrals to other network providers. And if you're going to refer to a provider that's outside of the network, you have to get special network approval. So kind of like a managed care situation for those network claims. Those injured employees not subject to a network, non-network, again, it's any willing provider. No application is required for those doctors. We do have a text comp profile that they can create, but there is no training or application required to see a non-network injured employee. Medical reimbursement is determined by our fee guidelines. And I'll just do a little commercial here for professional fees for non-network. That means, let's see, in the office, professional fees is paid at 217% of Medicare in 2025. And for surgery, say you're working for an orthopedic surgery surgeon that's doing surgery while your patient's in a facility, your professional fees are paid at 272% of Medicare rates in the state of Texas in 2025. And generally, we ask that all of you use the Medicare payment policies, that's reporting, CPT code choice, all of that in the workers' compensation system. For the polysubs, political subdivision, again, it can do one of three ways. Through a network, that means you're going to have a contract, and you're going to follow the network rules, or non-network, which are the rates and all the rules associated with non-network, or directly contracting. Either way, your front desk people need to know who you're contracted with and what the contract says. So those are the three ways. Now let's talk about what happens when an injury occurs in the workplace. There are some regulations that surround the notice of injury. This is in that administrative code, also known as the rules. Chapter 120 is for employers. What do they have to do when an injury happens? 122 is for the claimants. Those are the patients or the injured employees, if you will. That's chapter 122. And 124 is what the insurance carrier does after a notice of injury. The employees, let's talk about the employees' notice first. The employee, if they're injured, notifies their employer within 30 days of the date the injury occurred. Hopefully, they're letting you know right away. Or say they had an occupational disease. It should be if the employee knew or should have known of an occupational disease that may have been related to employment 30 days after that date when they realized that occupational disease was probably work-related. Now, that is their responsibility. And next, they select a treating doctor. If they're part of a network, they need to choose a treating doctor that is in the network, unless it's an emergency. And they should be telling the doctor that it's work-related. And you, as a doctor's office, should be asking on every patient that comes in the door, is this work-related? There is a document that Patricia may put in the chat on patient rights and responsibilities. And part of that says that they should inform the doctor that it's work-related. And that's important to you doing registration and screening. Now, they may not tell you, but document that you asked and what they said. The employee's notice of injury or occupational disease. This is the form that the injured employee uses to report to us, DWC. It's the Form 41 within 1 year from that date of injury. And we want the injured employee to stay in touch with the employer and the insurance carrier during this notification. So 30 days to let their employer know, and 1 year as a deadline to let us know. That's for the employee. Now, the employer, you're going to be filing the first report of injury. You're going to give the employee a written copy of their rights and responsibilities, and Patricia posted that in the chat, including whether they need to choose a doctor from a network and what those network requirements are. So a list of those doctors, you need to make sure the network is letting them know how to find a doctor, or you let them know they have to choose from the network of doctors that are contracted. Now, again, if it's an emergency, they can go anywhere at the beginning, but as soon as it's not an emergency, they need to go to a network doctor. And the employer files that first report of injury. It's the DWC Form 001 with the insurance carrier if the employee loses more than 1 day of work. So that's your responsibility, employer, or some of them. Now, the insurance carrier's notice of injury. The written notice of injury is the insurance carrier's earliest receipt of the FROI, which is the first report of injury from the employer, or we tell them. So we tell the insurance carrier that there was an injury. So that is the notification time. Also, if any other documents get to the insurance carrier, regardless of the source that fairly informs that insurance carrier, that those pieces of information there, the name, proximate date of injury, and that it's work-related, that could start a series of events of notifying the carrier that there was an injury. Could be your medical bill. So if there's no first report of injury and they receive your medical bill, the carrier shall contact the employer regarding the injury within 7 days of notification. Now, once the carrier receives the first report of injury, they're going to create a record of reportable injuries. They're going to start the investigation. So it's best as an employer to let your carrier note as soon as possible, because as days pass after that injury, details about the injury and how it happened are going to get fuzzy. So the sooner you report it, then the sooner they can conduct their investigation and start initiating benefits. And the carrier is going to notify DWC if there's a denial of that claim based on non-compensability. Remember, we talked about what compensability, whether it's covered or not, or lack of coverage. So the carrier, the sooner you notify them, the better, and they can start their responsibilities. Now, if a carrier receives the first report of injury, they investigate it, and they decide that they're going to dispute. They're going to deny that it's not compensable or they were not liable. Say maybe intoxication was involved or other details and those exceptions, or refusal to pay. That's in the plain language notice 01. There's a picture of it there. Now, if the plain language notice 1 is filed between the 15th and the 60th day after the receipt of written notice of that injury, the carrier is still liable to pay all medical services before they filed that PLN 1. Take a look at that. If you're urgent care, if you're one of those healthcare providers that see the patient at the beginning, again, the carrier can be responsible if they filed it up between the 15th and 60th day, all the services up to the day they filed that. So pay attention to that language there. This is a denial of the entire injury. It doesn't mean you can start billing the patient, though. It just means the carrier does not believe it's compensable. We have processes or administrative remedies in place to resolve these disputes. Now, on the network side, there's a special provision that says before the carrier provides written notification to the network healthcare provider that they're denying it, they can't deny any medically necessary healthcare services based on compensability until they file that, and they're liable up to $7,000 of reimbursement for those medically necessary healthcare services. So a little bit of special twist on the network side. Again, even if they're denying the entire claim, the carrier may be liable for some of the medical services up until the day they notify you. So that is, we covered the PLN1, which is the denial for the entire claim, or they're disputing that it is compensable. Now, after you're treating the injured employee at any time during the life of the services, the medical services that the injured employee is receiving, the carrier is going to be reviewing medical records and any other documentation that comes into the insurance carrier. And if the carrier sees that there are either diagnoses or conditions, or maybe treatments or services that the insurance carrier believes that are not related to the original compensable injury, the carrier can file a notice of disputed issues and refusal to pay benefits. That's called a PLN 11, plain language notice number 11. And they're going to send it to the injured employee and to the Division of Workers' Compensation. If you're the healthcare provider, you might want to ask the adjuster for a copy of it if you know it exists, but this can happen at any time during the life of that claim. So this is a PLN 11. It's not saying that there was no compensable injury. What it's saying is there's something in there that they believe that they're not responsible for, because an insurance carrier should only be paying for medical services that are related to a compensable injury. If it's ordinary diseases of life or services that aren't related, they're going to question that. Now, the PLN 11 must be filed by the carrier no later than, if they're going to deny you payment on your medical bill, they have to have filed that PLN 11 or the due date in which the insurance carrier was supposed to pay or deny that medical bill. So if you receive an explanation of benefits that says we're denying for extent of injury or not related, then you need to know that there should be a PLN 11 filed with us officially. Ask for it from the adjuster. The rules don't require the carrier to send it to you, but some of the carriers do send it to you. I would ask for it. So if you feel like someone in the system is not abiding by the rules and the laws, you can file a complaint with us. And there's several ways to do that. And this is the last bit of information we're going to share with you. There is a form you can fill out. It's right there on your screen. Or you can, as simple as filing an email to that DWC complaints at TDI. You can fax it in. You can take it in person to one of our 20-something field offices across the state of Texas, or you can do snail mail and mail it to us. There's a link. Under C for complaints, you can find more information there. So we work off those complaints and look into the system and see if people are complying. That is your overview. I'm going to recap. We looked at the regulation, the goals, the legislative intent, mission, employers, they have an option to have workers' comp or not, required forms, providing health care to injured employees, and the official notices I just reviewed. Now, let's see if I can pull up the poll and see if I transferred knowledge to you. I'll review question number 1 to find workers' compensation specific information on the DWC website. A healthcare provider should use the Use Workers' Compensation A through Z on the Workers' Compensation tab, not the topics A through Z on the top right corner. Most of you got it right. Tried to emphasize that during the presentation. You can try to use that larger A through Z, but it's going to take you to the whole insurance website. It's best if you're looking for workers' compensation to use the workers' compensation A through Z. Thank you for that. And number 2, which of the following is true about workers' compensation insurance coverage? First one, workers' compensation insurance covers injuries even when the injury is the employee's fault. Second one, workers' compensation insurance covers medically necessary treatment for a compensable injury. There are no copays and deductibles. And not all Texas employers have workers' compensation coverage. All of those are true. All of those are true. So all of the above is the correct answer, even though, yeah, if you guess some of the others, they were true too. Number 3, is the work status report, the Form 73, needed to be completed on every office visit, no matter if there's a change, work status, or activities? The answer is no. So some of you got that right. Work status report, you need to follow the rule 129.5, which Patricia posted in your chat. Only the first visit, when something changes, or upon request by the insurance carrier. Now you can try billing it, but the carriers can deny because it's not required by the rule. Number 4, does a doctor need to be certified to conduct an impairment rating exam? The answer is yes. You have to have special training in the AMA Guides 4th edition and certified by us to conduct an impairment rating. You can do MMIs without being certified, MMI date, but not an impairment rating. That requires special training. Number 5, the notice of disputed issues and refusal to pay benefits, PLN 11, can be filed by the insurance carrier at any time during the life of the claim. The answer is yes. If they believe there's a condition or treatment that's not related or doesn't extend to, they can file a PLN 11. Doesn't mean that it's final. The Division of Workers' Compensation is the administrative remedies, provides the administrative remedies to resolve those disputes. I'm going to stop sharing now. Thank you for answering those 5 questions. And lastly, we're always there to help you at Comp Connection at 800-252-7031, option 3, or you can email us at compconnection@tdi.texas.gov. Thank you for watching this video.